Hey everyone, so my name is Élorie. I'm a student here at McGill University in occupational therapy. I just want to specify that nobody from the faculty has verified what you're about to see. It's solely for my pleasure that I'm producing this video, so I hope you enjoy and you learn something new today. Spinal cord injury. There's a lot of misconception here, so let's debunk some myth about it. It's not unusual for someone to claim scandal when they see somebody in a wheelchair that has use of their leg. Let me explain why some people might need to use a wheelchair even though they have some motor function and or sensation in their lower body. You have what we call complete and incomplete injury, and most of the time in spinal cord injury you will have incomplete injury, meaning that there is still some motor and or sensory function in parts of the body. So somebody could be considered para or tetraplegic and still be able to move their limbs. They are still affected by paralysis or loss of some function. Okay, that's pretty important to take into account. So no, people are not faking their spinal cord injury even though they can move. And then there is para and tetraplegic. Paraplegic meaning an injury below the level T6, and tetraplegic or quadriplegic is an injury above, meaning it affects the upper level of the torso and arms. So if we take a look here to understand a bit more the physiology of things, we have like a slice of the spinal cord, as if I would have sliced it here, okay? So there's the brain, there is the brain stem, we have the cervical enlargement, so it's a part of the spinal cord that's a bit larger because there is more nerve bodies because they innerve the arms. There's the same thing for the legs, so it's the lumbosacral enlargement here. So in blue we have some sensory nerves. So pain, temperature, touch, vibration, deep pressure, that all goes through those blue and things, and there is different pathways. So you can see one at the back, one at the front. They carry different information. At the front it would be pain and temperature, and at the back it would be sensation, fine touch, vibration. And in red you have the motor information, so coming from the brain down to the body to be able to move limbs. So yeah, you have two motor neurons in your whole pathway. You have one from the brain going all the way down, and another one starting here in the spinal cord and going to the limb. So you have the upper motor neuron, okay, so upper motor neuron, and you have one below, okay, lower motor neuron. When an injury occurs, you will have total loss of motor function and reflexes because there's inflammation in the spinal cord, but as the time goes on, you will recover some reflex and or motor function if there is some to recover. Let's go over why. The upper motor neuron give information to the lower. Okay, just to repeat, here you would have the lower, and here you would have the upper. Now, the lower receive both information from the upper motor neuron, but also an interneuron. A neuron between the sensory information, so touch, and movement. So somebody may not be able to initiate movement with their brain, with their own sheer will, but because there is still that interneuron injury preserved, you will have a loop with the lower motor neuron creating reflexes. Okay? So if there's an injury to the upper one, okay, you will have a reflex loop down there, which will happen. Let's say if you're at the doctor and you hit your knee with the hammer, the usual one would be mild. Somebody with hyperreflexia would have a big knee jerk. Now, if you have injury to the lower motor neuron, so this one here, it doesn't receive information neither from the upper motor neuron nor the lower motor neuron. In that case, you have no reflexes, so it's what we would call flaccid paralysis. So the limb is very limp. There will be lots and lots of muscle atrophy. In the case of an upper motor neuron injury, you will still have some muscle atrophy, but it will be a result of lesser use, okay? Not for the same reason. It will be very less severe. So this is the different presentation, whether you have an upper motor neuron injury or a lower motor neuron injury. So when you see somebody in a wheelchair, you cannot simply by looking at them knowing all of those, if it's a complete or incomplete injury, if it's para or tetraplegic, if it's an upper or lower motor neuron injury. So please be kind. If the person is using a wheelchair or other assistive device, it is because they need them. So take that in mind, and I hope you learned today. Thank you.